what is your opinion about the doctor having a student or an internee present during a private consultation? This is very quite a common practice, especially in the Ayurveda centers associated with Ayurveda colleges, that those internees will be there. My personal opinion is that it's all fine, and we are all professionals, and the students are also kind of professionals. They will not be revealing their own patient's private information anywhere else. So it's kind of a standard practice almost everywhere. What is your opinion regarding this, sir?
One should not feel worried about the internees because they are the future doctors. If the future doctors are not properly trained and they are not well versed in their subject, and then how they are going to treat in the future? So, whatever bodily or health condition evolved in you, may be a good information for him to learn. So, you should not feel that in a private consultation they will do. So, nobody, no doubt. That is the ethics what we are being bounded in the beginning itself, that we will not disclose any information of these patients to any other fellow. Even to the family members also, many times we don't disclose the information. Only and when and this is necessary to disclose, then only it will be disclosed. So one should not feel something like annoyed or something like that, that somebody is there, how can I know all these things. Be feel free, explain your problem to doctor in front of the internees. Then they will also have certain ideas and they will also have some doubts. They will get your clarification, and even that will be a real way of learning for them. And one should encourage them, because see, it is something like that, somebody has donated the body to the Department of Anatomy, and that will be the basis for the dissection of the young students who are coming to the field of medicine to learn about how the body structure is. And if nobody starts giving the body to the Department of Anatomy, then how they'll learn? Then they have to learn it on a simulator models, which cannot be 100% exactly the what the body is. So, but you should not feel embarrassed or something annoyed about the presence of internees or something. If whatever it may be, usually in a private consultation also, if it is a young doctor or a young generation, it should be entertained. They'll be learning the things, and that will give them a clear idea of treating things. And who knows that someone may out of them may become a good, beautiful doctor in the future.
If it is like psychiatric counseling and a very deep personal matters, then they can always request the internee to stay out if the situation demands.
No, even in that situation, why you want to push out the internees? Because even internees should also get the information how to counsel in the deepest form things and the deep troubles in front of thing, how it should be handled. They'll have first-hand information. It should be learned in that way only.
So the mantra is just consider the internee or the student as another doctor and trust. I mean, we never used to discuss all the. When we were internees, we were standing alongside the other doctors, seeing hundreds of patients. We never used to discuss all those patient things anywhere outside. It's kind of ingrained in a Ayurveda student practitioner to keep the secrets as secret. Just learn the things.
Usually, the students' mentality is that if something is there, they will be concentrating on the disease part of it. They will not be concentrating about the who are you, what you are doing, and nothing. They don't have that information or interest in that. Their interest is that what is the disease, how to handle this. So that will be the idea of our students and those internees. So we should not feel bad, or we should not avoid those things. And internees should be there. If it is there, no problem. And if you don't want to that internee should be there in your consultation, then you should select such a private consultation where internees are not present. That is the only option left with anything. If you want a best doctor, and that doctor will always have a follower, junior doctors. So the junior doctors will be trained in on hand training. That will be of this nature only. So no question of that feeling bad or something like that. These are the young and future doctors. They should be given a proper opportunity to learn, and they educate themselves, and they get skilled in a particular manner, so that they can be future doctors. Maybe in future, some other time, that for my own problems, they will be the one who treat us. So we should entertain them. We should not be just avoid them.